Right, well, there is a particular disorder called obstructive sleep apnea, which some people are familiar with and some people aren't. People may know it if they know someone who wears a mask when they sleep at night. And this is usually seen in people who snore, and it's a condition when they are breathing in, the back of your throat kind of makes a little bit of a rumbling sound when you snore, like a... Now, if that gets more severe, you can actually pull the back of your throat closed so you stop breathing. So it'd be like a... and you start breathing again. Now, anyone who's had a spouse or someone do this would recognize what I just enacted. Now, someone who's never seen that would say, well, if someone's doing that in their sleep, of course they would wake up, of course they would be aware of it. The amazing thing is that often people have no idea that they're doing this. It can happen as often as 10, 20, 30 times an hour. And usually we get clues that it's happening, not from someone coming in saying, I stopped breathing in my sleep, but what they say is that I'm very tired during the day, I fall asleep pretty quickly at night, I wake up during the night to go to the bathroom a few times, which happens to work out that way because the kidneys don't concentrate urine the way they're supposed to if you're waking up all the time. But usually they think it's from something else, from drinking too much water or something like that. A lot of times they'll have dry mouth and they'll wake up in the morning and they'll not be very rested, and then kind of during the day they'll feel kind of sleepy, say in the afternoon or something like that. Severe cases, they may be sleepy when they're driving and kind of be dangerous. And when we see these patients and we do a sleep study to see if they breathe when they're sleeping, a lot of times we do find that they do stop breathing quite a bit. As far as health concerns with this, every time you stop breathing, that sends a shot of adrenaline throughout your body. And if that happens 10 times an hour, 8 hours a night, say 100 times a night, 36,000 times a year, that ends up causing a lot of damage to the body in various ways. And we know people who have sleep apnea more likely to have high blood pressure, they're more likely to have heart attacks, they're more likely to have diabetes, more likely to have strokes. And there's an arrhythmia called atrial fibrillation, which is quite common as people get older, and your chance of getting that is much higher if you have untreated sleep apnea.